My name is Shaun Hussain, and I'm a pediatric epileptologist or epilepsy specialist at UCLA, and I'm the director of the Infantile Spasms Program. And as you can guess, I specialize in infantile spasms, which is unfortunately a terrifying form of childhood epilepsy. It strikes children in the first year of life, often between the ages of 4 and 12 months, and it is very different than other kinds of epilepsy. Usually when we think about epilepsy, we imagine older kids or adults who have frank convulsions, who are foaming at the mouth, who lose consciousness, who fall, who have traumatic events. But this contrasts with infantile spasms. These seizures are anything but. They're subtle. It's often just a shrug of the shoulders and a slight head drop. And these 1-second seizures can easily be missed. They tend to happen in clusters, especially upon awakening. It's easy for people to not know what these are, but it's pretty typical that parents recognize them. The other big difference about infantile spasms is the impact on development. Certainly seizures in general are not good for you, but infantile spasms can cause mental retardation, intellectual disability. They're associated with autism. They are associated with early death even. And to make matters worse, the treatments available are not all that friendly. The big treatments are ACTH, a hormone, and a similar drug called prednisolone, both of which are pretty effective, especially if you treat kids early in the course of their disease, but they carry serious side effects like immunosuppression. They can increase blood pressure or cause heart failure. That immunosuppression is especially concerning because these patients can have small infections, typical bacterial infections like an ear infection, which can blossom into truly dangerous and life-threatening infections like sepsis. So it is incumbent upon us to identify these patients early so that we can treat them effectively with these drugs that are fairly toxic but highly effective. The most dangerous thing about infantile spasms is that they might go unnoticed, that they're untreated, or that treatments aren't successful. That's when truly terrible outcomes occur. Now, in our practice, we've noticed that patients often have a long delay between the actual onset of these seizures and the time that they show up in our clinic. So it is incumbent upon us to identify these patients quickly because response to therapy is reduced with delay in diagnosis. We've seen that delays of as little as 1 week are associated with irreversible reductions in development. So that's pretty scary. And when we look at the patients in our clinic, we're casually noticing that some of them are having months of delay, which really puts us behind the 8 ball in trying to get control of these seizures. But we don't know exactly where the problem is. Our suspicion was that maybe some pediatricians are not aware of infantile spasms, are falsely reassuring their patients that these subtle movements that don't really resemble most seizures, maybe they're reassuring those parents that these are normal baby movements. But we weren't sure. We wanted to set out and do an objective study and try to figure this out. So what we did was that we used the size of our clinic. We follow about 400 patients with past or present infantile spasms, and we found the first 100 of them, and we surveyed their parents. And we asked them everything about their experience with infantile spasms, when the spasms started, who they sought care from, how long that took, who was their first neurologist, who was their first pediatric neurologist, where these encounters occurred, and we paid special attention to the timing. And we weren't surprised to see delay, but we were shocked to see how big the typical delay was. Now, although half of patients got in pretty quickly, the ideal is that patients see these suspicious events, they are alarmed appropriately, they contact their pediatrician recognizes these events, they call me the next day, they're in the hospital that day getting treatment, so that there's a minimal delay. And in general, we would like to see the time from onset to initial treatment under a week. That's pretty good. But we saw that only about 1/3 of our patients had diagnosis and treatment that quickly, and that about 1/3 had delays exceeding 1 month. We even found a few with delays exceeding 1 year. So looking at that data, it's pretty horrifying because we know the consequences of that delay are diminished developmental outcomes. This is preventable change in cognitive outcomes, and potentially because of it may be affecting even survival rates. We don't know. In general, I think it is a knowledge gap. And it's good that if you're familiar with those guidelines and if you're familiar with infantile spasms at all, you're already ahead of the game and you're more likely than most pediatricians or most primary care providers to identify infantile spasms quickly and facilitate a referral. But there are a couple problems in the process. So we cannot place blame solely on pediatricians or emergency room providers. Number one, infantile spasms is certainly, it's the most common epilepsy syndrome with onset in the first year, but it's not that common. Only about 1 in 2,500 kids will develop infantile spasms. And that translates to the average pediatrician only seeing approximately 1 to 3 cases in their career. So I'm giving them a hard time for missing something that they're only going to see for as the first practitioner encountering that child, once every 10 years approximately. But it's a very short list of diseases that cause mental retardation that are preventable. So that deserves extra attention. So certainly we want to reach those pediatricians. We want to reach neurologists, especially adult neurologists, who might not be as familiar with infantile spasms. Unfortunately, there is a shortage of pediatric neurologists and epilepsy specialists throughout the United States, and that results in patients having to really either travel long distances or kind of operate under the assumption that pediatric neurologists don't even exist. A lot of times people don't know. So when these diagnoses are jumbled, it's surprising that patients are actually turning to the internet to try to figure this out. And it's actually not such a bad strategy these days. In general, we are alarmed when our patients seek medical guidance over the internet because there's lots of incorrect or exaggerated information. But when you have a trusted physician who is making an incorrect diagnosis, who is failing to identify as a truly serious form of epilepsy, the internet may be a good second best option. And we have many patients who have told us that that is how they figured it out, that they posted a video of their child's events, that other parents saw it, that they were Googling things like head drops or spasms, and they figured it out on their own. And then they contacted us and reached out. I'm worried about all the patients who don't go to social media in those circumstances. And I worry that there are patients who are never making it to an epilepsy center because no one ever figures out that this is even epilepsy until it's too late. Yeah, so certainly we are trying to do that even on our own with our website called infantilespasmsproject.org. It's a nonprofit site with general information that is friendly to parents, but also appropriate for general practitioners. It has a set of videos. Certainly if there are any viewers who don't know what infantile spasms look like, please visit our site, check out the first video. It's 30 seconds long. You'll remember what they look like, and you could save a child from preventable mental retardation.